Hello and welcome to another episode of Unique Professions. Have you ever had a pet that, pees in your plants, rips up your clothes, and you wonder, what on earth are you doing? Why are you doing that? Well, today my guest might be able to shed some light on that. It's an absolute pleasure to welcome Dr. Kate Lindsey. How are you?
I'm very well, thank you. Thank you for having me.
No worries. Now, you've done got quite a few things. You're a zoologist,
Yes,
you're an animal behaviourist, and you're also a vet.
I am.
So you're multi-skilled, and your business is Kalmpets.
It is.
Now, Kalmpets, that's spelt with a K. Why did you found that?
It actually took a long time for me to find that profession because when I first started out at uni, I didn't know that there was such a thing as a veterinary behaviourist, and I didn't know that animal behaviour was something that you could specialise in. But what I really, when I reflect on where it all started, was from the minute my earliest childhood memories, I have always had an absolute obsession with animals of all kinds. Just, where are they going? What are they doing? How are they eating? Where do they sleep? What do their houses look like? Always been absolutely fascinated. And of course, David Attenborough had a lot to do with that as well, and all his programs, which I used to watch a lot when I was a child too. So that's where it all began. And zoology, which is the study of animal behaviour, was my first degree. I didn't know what I wanted to do. Mm-hmm. When I got to uni, I had no idea. I just knew I really, really loved animals, and was there a job that existed where you could just love animals? And, that was one of the greatest skills that you needed to have. So I did animal behaviour, and towards the end of that degree, I started thinking, well, now what am I going to do with this? And I thought, well, actually, I'd really quite like to be a vet, and went on to study to be a vet. I managed to squeeze in the whole degree in 4 years, but I did have to do a lot of extra time in the doggy morgue and on my own and all that sort of thing, doing anatomy. And then I distinctly remember the day where I thought, we've got to be able to do better than this, where there was a cat sitting in an enclosure on its toilet, very unhappy, and it wasn't allowed to leave the clinic until it had weed in the litter tray. And I really started thinking, I just don't understand why we do these processes that we do. And then this flyer came on my desk, an animal behaviour conference, which I went to, and from there, the rest is history.
Mm. And so when did you actually set up Kalmpets? How did that process evolve?
So when I started studying for my memberships in animal behaviour, I started to get, just by a word of mouth, I'd spoken to vet colleagues saying, I'm starting to see behaviour cases, and they started filtering these clients through to me, which I just did at their homes. And I did 3-hour-long consults, which are really long consults. It's a bit different now. And there was just such a great need for someone that understood a little bit more about animal behaviour than was currently available, and it just grew from there. So that started in 2012, and it's just grown from there.
Excellent. Now, when you look at we'll go with a dog, I suppose. When a client comes to you, what are some of the things that you initially look at in your initial process or your initial assessment?
So it's quite comprehensive because animals can't use English. So that makes it hard. They're non-verbal. They're not really non-verbal. They just speak in a very different way to us. And so what I like to do before the consult is I collect a whole lot of information about where did they come from? Did you meet the mum and dad dog? How many puppies were in the litter? What kind of training have you used before? What does your dog eat? What does it poop look like? A whole lot of different questions. And then during the initial consult, I'm looking for behavioural signs of anxiety, but I'm also looking for physical ailments that may be a contributing factor. And it's very common for there to be other health issues in my patients. So I go through all of their medical history. And not surprisingly, lots of my behavioural patients have extensive medical histories as well, because when they've got chronic anxiety and stress, their immune health doesn't works quite so well, and they tend to be allergic dogs with itchy skin and tummy upset and chronic ear infections, or they've got pain. So I look at all of that history. From an outsider looking in, they might think, gosh, that looks like a really boring consult. But there's a lot going into trying to work out why is this animal doing this behaviour that its humans don't like.
And also, with that kind of thing, it's almost like, when a doctor for a human, that's what they're looking for as well. So I see a lot of similarities.
In fact, the profession that is most similar to what I do is psychiatry.
Yep.
But it's not, you can't just go, we're just going to look at mental health, because you can't ignore what's going on in the rest of the body, because it's all linked.
Yep.
So you're absolutely right.
So and just going back on the old link, because pain in the form of if I've got a stomach ache, then pain in my leg, or that's also going to affect my health upstairs as well.
Absolutely. And if you're anxious too, then you're going to feel pain a lot more sensitively than others, because your body is already under stress. So you can't separate mental health from physical health. They're intimately linked, and a lot of the neurological pathways, especially pain and anxiety, are very much inseparable, because it's all about your body just trying to protect itself.
Do you think animals in general, or dogs and cats, can they sense that when a person is, has that sort of issue?
They absolutely can. They read human body language really well, and they know when their humans, in particular their family, when their body language is changing. So they can often alert you to problems, or can be sensitive if you're having a particularly tough time as well.
Now, obviously you work with all sorts of different animals, dogs being probably predominantly number one. Let's go with another very popular household animal, cats.
Yes.
Now, is there a difference between, you're working with cats and dogs? Is there a different process?
It is. It's slightly tricky with cats, because I like them to choose whether they're going to come out of the cat carrier or not, because there's no point in me forcing them to come out of the cat carrier, because all I'm going to see is a cat that's stressed, and that's not going to give me any useful information. So some cats will come in and they will just decide, no thanks, Dr. Kate, I'm not coming out of the cat carrier today. You are far too scary. I'm staying in my safe place. Other cats, like a cat I had a couple of weeks ago, he came in and he was thoroughly investigating every nook and cranny of my consult room, and wound up behind my monitor of my computer, stealing every now and then a little paw would shoot out and steal another thing from my desk, and then chewing things and walking across the keyboard. And so the process is slightly different, because they're more agile, and they are much harder and to read in terms of if they do have physical limitations. They hide pain very, very well. And so you do have to do a much more thorough behavioural history for cats.
And I guess my question is following on from that. Why do the cats have hide pain so well compared to dogs?
I think because they are used to being, from an evolutionary perspective, they're more used to being a solitary animal. And when you're a solitary animal, you've got to be a lot more, put on a more confident face, so to speak, and you've got to be more, because if you're looking weak, then you're going to get picked off by other predators. Yep. So whereas dogs are used to living in a family group, so they've got the net. Yeah, exactly. So cats just need to be tougher, because they can live solitary lives.
Because that kind of goes back to the ethos of survival of the fittest, really.
Absolutely, yeah.
And so like cats, who may not have that family group, they're off, like you said, they're off, fending for their own.
Yeah, and this is one of the things that I love about cats. They are the most adaptable, most robust domestic species that we have. And they can live solitary, they can live in a group, they can live in, multi-species households. They're incredibly adaptable, and just a magnificent animal in so many ways.
Well, they say cats have 9 lives as well.
Absolutely. I mean, and they do, because they're made of rubber.
Yes. Now, when you when a client comes in with an animal, how do you measure success?
That's a really great question. My ethos is it's a marathon, not a sprint. So when we're trying to change behaviour, we want to know that it's going to take time. There's no magic bullet that's going to fix them yesterday. It is going to take time and it's effortful, but we want to always be progressing in a forward direction, and I don't mind if it is at snail's pace as long as it's in the positive direction. So we're aiming very quickly, we're aiming to have positive behavioural momentum, but we measure success really when I get progress reviews. So I'll always check in at intervals. So it's a very different to primary care, vet medicine, because I do need to have a lot more contact with my clients, and I check in with them at regular intervals, either via little email updates or phone calls or phone consults. But they do need to have more than one review with me, because I need to make adjustments and especially need to know if we're not heading in that positive direction.
Do you ever find, after a period of time, that there might be regression as well?
Sometimes that can happen, and usually when we have behavioural regression, the first thing we want to look for, okay, what's changed in this body? Is it winter? Have we got arthritic pain? What's going on with appetite? What's going on with stools? What has changed for this in this animal's body that means that we were going absolutely fine and now all of a sudden we've taken a big leap backwards?
How do you find, let's say, the environment, like the homes of people? How big is part of that?
This is another really good question, because people often either they blame something in their home environment or they blame the way they've raised their animal on their animal's problems. But we know that when it comes to behaviour, that it's a combination of genetics, environment and experience that has ultimately led to any one behaviour that your pet is displaying. And managing the environment is often really important part of a treatment process, because if you've got a really destabilising environment where you've got people coming and going all the time, or it's very noisy, or there's no regular routine, or you've got FIFO workers or night shifts and there's lots going on all the time, then it can be very destabilising for your pets. And so taking into account the environment is really important, because if you don't manage that as best you can, then it's going to limit the success of any program.
Okay, when a client comes to you, what are some of their main reasons why they come to you? What are some of the common ones that you get?
One of the two most common ones with dogs are barking
Yep.
and aggression.
Yep.
And cats, again, it's aggression and peeing.
Yeah. Oh, well. And I guess you were saying about different breeds as well. Have you found that some breeds of dogs are more prone or prevalent to have issues?
Absolutely not. The dogs that I see across the board are generally, I see the most popular breeds most frequently, which makes sense because there's more of them in WA. But there's no such thing as an anxious breed or an aggressive breed. It really comes down to the combination of genetics, environment and experience. And a big factor is, of course, the genetics of the parent dogs. And I often get asked this question of, what breed of dog should I get, Kate? And I'll always say, well, the breed is really not particularly important. It's more, what are the genetics of the parent dogs? Have they got healthy genetics? Have they got healthy behavioural repertoires? Have they got history of pain or medical disease? Because the best advert for the future behaviour and health of your puppy is not going to be the puppy, it's going to be the mum and dad dog. But that's easier said than done. It's not always easy to be able to meet the mum and dad dog.
And that was the other question, about if you don't know who the mum and dad dog are, how do you actually access that information?
Exactly. And I don't also want to dissuade people from adopting rescue dogs, because of course we're never going to know. We're not going to know what the mum and dad dog's behaviour are like for those dogs. And it's one piece of the puzzle. So we've got genetics, environment and experience. Genetics, we want to try where possible to have good genetics, but that's really up to our breeders. And the rest we can have a little bit more control over.
Now, I'm just going to move away from cats and dogs just for a minute.
Okay.
You also do have other animals or other pets that you help out. What are some of those? What are some of those most common ones?
I have done consults for birds
Yep.
and for rats.
Mm-hmm.
Other than that, I think that's really pretty much the limits that I have gone to of unusual pets.
Yeah.
I've done some other unusual consulting in my life, but yeah, I think that probably one of the most unusual was two house rats that just simply weren't getting along.
Okay, and how did you deal with that?
Well, in that case, we needed to look at their enclosures and we needed to increase the stimulation in the environment. So we needed to give them more outlets for normal rat behaviour, and we needed to create positive interactions. So when they were around each other, something good was happening for them.
It's almost like children, really.
It's a lot like raising toddlers. All animals, in fact, it's just a lot like raising toddlers.
Yeah. Give them stimulation,
Yes.
give them a good environment, and away you
Reward
go.
the good stuff.
Yeah, exactly. Yeah. How has your techniques evolved?
My techniques have changed a lot, and I really do. It's constantly evolving, the way that I do things, because I am guided by my patients mostly, and meeting their needs better and better as time has passed. Having treated roughly 11,000 animals for behaviour problems, I'm constantly changing what I do. The consults did used to be 3 hours long, but I realised, because that was what was traditionally done in veterinary behaviour medicine, and I realised that by the end of the 3 hours, my clients' eyeballs were all red and they just had this like dropped face expression of complete overwhelm. And the dogs and or cats were always fast asleep. And it was just too much information overload. It is a wonderfully thorough approach, but no one can sit through that long. And so then I went to 2 hours, and then now I do 1 hour. And I found that even 1 hour is a little long for clients. I'm very used to it because I've been doing it so long, and I find an hour goes like that. But I think that an hour is the perfect duration of time for an initial review, and it gives me just enough time to get all the information I need to be able to make a diagnosis. And that is one of the most important parts of the initial review, is defining the problem for the patient and working out what is going to be our treatment timeline.
And obviously when you define the problem, even human doctors would say this, you can't just treat everyone with the same symptoms or the same thing, as one.
This is a great question,
So,
because people will say, I'll sometimes get little emails from people saying, oh, I've got this patient and it's been doing X, Y, and Z. What do I treat it with?
yeah.
And there's a big emphasis there on the use of medication, which is a very, very small part of treating any health issue. And there is not one treatment program that will fit anyone other than just that individual, and it is really important that you tailor the treatment program for the individual and you understand what is going on for the individual. Otherwise, and you're constantly changing what you're doing and adjusting it to get the optimal results, because if you just use a one fit plan, it's going to fail.
Do you think we overuse medication
I don't know that it's overused. I think it's just I think the thing about when you're treating brains and you are using medication is it's really frightening for a lot of people, especially when it comes to using it in their animal who can't speak English and say to you, oh, geez, I'm feeling really weird on this medication. Yep. And when you use it correctly, you want to use a medication that is relevant for the problem that you're trying to treat, which makes sense.
Yep.
You want to not only use it at the right dose, you want to use it at the right frequency, and those things are really going to be determined by the patient's response. So it's especially more so in mental health than any other area of medicine. You've really got to be very, very careful. And my motto is start low and go slow. We're not in a rush. We're in a marathon, not a sprint. And if we are going to use medication, we also want to know what exactly is that going to be doing, and how are we going to assess the response to that. And most importantly, we only want positive outcomes. So we only want to use medicine that makes our patient feel good. We don't want to turn them into a zombie.
Yep.
And I think that's when you use them with that in mind, they are enormously beneficial.
And I guess though also, with you want to actually try and change the behaviour of the pet by using your approach first, I suppose.
Yes, so I sort of talk about, I work collaboratively with a lot of different trainers, and my role on the team, as I see it, is I need to get this body and brain functioning optimally so that behavioural change can happen.
And I know you said it's a marathon, and it's, you take it slow, but is there a certain point, is one, maybe let's say you've got, 6 to 8 weeks, ballpark, is there a moment where you start thinking, halfway through it, hang on, this animal has not, responded to anything? Is that then you start going, okay, changing techniques or doing something different?
Absolutely. So I always like to check in at the 4-week mark and make adjustments there, because I do, if I am using, especially if I'm using medication, I use them at tiny little doses. So I want to review it at the 4-week mark just to see that I haven't got it too low, because there isn't any point in using medication at a dose that isn't effective. That's just a waste. So we do want to review it at that point, and then there may be other review points. But if I start to get towards the 4-month mark and we are not getting any positive momentum, that's where I start to think, okay, we need to take a different tactic here. There's something else going on, or we need to try a different avenue. And one of the most common reasons why they're non-responders is because there is underlying disease, and it might be pain, or it might be a hormonal disease or something else going on that is really impacting how the treatment is working.
And with those sort of diseases, once you discover that this dog or cat has something, and let's just say it's an incurable disease, is that just more pain management?
Yes, so pain is very difficult to manage in animals because they're not always very clear with how they're feeling. But one of the most common signs of pain in any pet is behavioural change, and one of the most common manifestations of that is signs of anxiety. That is something that we commonly see with pets that are suffering pain.
And I guess with pain, suffering, and how does that, when you finally realise, okay, this dog or cat is in pain because, let's just say, it's starting kidney failure, for example, how do you go with your clients? How do you actually explain that to the clients?
That is hard, when there is organ failure is starting, because there is a balance between where we're trying to delay the progression of this condition for as long as possible. We're trying to minimise the suffering that they're experiencing, but we also need to know where is the end point to all of this. There's obviously the inevitable end point for all of us. Yeah. Mm-hmm. We're all going to have that end point, but one of the things that my clients struggle with a lot is knowing when is the right time to let them go. Yeah. And one of my little bits of advice around that are that these animals, that they live in the moment. There's no tomorrow, there's no yesterday. They're not thinking, oh, gee, this Friday I might like to go down to the pub and catch up with so-and-so. They are living in the right now. And if we can't make the right now good enough, and we know that there is nothing but suffering ahead of them, then that's when it's time to say, okay, I love you enough now to let you go. Animals are animals. They're not humans. Yeah. They use animal language to communicate with us, and it's learning how to pick up on that language so that we can make the best decisions for them at any moment in time.
Now, I am going to talk about animal language. Now, obviously, as you know, they can't talk. Well, not in the way that you and I can. So What is their communication? I mean, obviously barking would be one.
Yes, they talk in so many ways.
Yeah.
So they use facial expressions just like us.
Yep.
And of course, those facial expressions are going to be different depending on their breed.
Yeah.
So if they are one of these squash face breeds
Yeah.
or, scientifically known as brachycephalics, like pugs or boxers, then their facial expressions are going to be very different to say if they were a Great Dane or a Whippet or a Chihuahua. They all have slightly different facial expressions. They use voice, they use their whole body, and they use their behaviours. So, for example, peeing on a tree, we just go, oh, wow, they've just peed on the tree, they needed to do a wee. Well, not necessarily. They're sending a little sticky note, a little post-it note, and they're saying, Fred was here, I'm a 3-year-old red cloud kelpie, and I'm male entire, and I come here at 3 p.m. on Tuesdays. And so they are constantly talking to us and to others, and sometimes we can miss the more subtle signs.
And do you think with that communication, is it sometimes a sign or of wanting help as well?
Yes, and I think that barking is a really good example. So the first time people know that there is a problem with their dog's barking can sometimes be an angry note in the letterbox saying, your dog barks nonstop and has been keeping me awake and do something about it. Yep. And that might be a dog that has separation anxiety, and the human attached to that animal may not be aware that barking is a problem because it is only going to happen when they're not home.
Yep.
And that barking sometimes is addressed by using zapper barking collars, electric collars, and the clear message that we give our pets when we use a punishment device like this is, I don't care that you're barking. I don't care that you're frightened. I just want you to be quiet. And so we do really need to be careful first, understand. This is why we need to understand, why is my dog barking? Because if we can understand why my dog barking, then but it is, they're calling for help. Especially some of these what people call attention-seeking behaviours, again, can be a call for help. I'm just a dog and I need some support, and so I'm going to shout at you until you give it to me.
And I guess with that, that support, how long generally, I know you kind of said it is a marathon, but generally, do you have like a indication of when things are starting to progress and when someone's getting ready to exit the program?
So the general average is that within 1 to 2 years, we want to be saying that we've reached a point where we have behavioural management, we have behavioural remission or resolution, and we're now going to start tapering off any medication that we may be using, and we're going to continue with the management that we're doing now for life, because that is supporting our dog. But really, it can be a lot shorter than that, depending on the problem. So especially if the behaviour problem is addressed earlier in life, then the treatment program can be 6 months, 4 to 6 months. But generally by the end of 1 to 2 years, you're looking at going, yep, we've reached our targets, and we have efficiently resolved this behavioural challenge for this patient.
And how important in aftercare is it that the owners or the family of a dog keep up your strategies?
It's absolutely critical, because when you're raising a dog or you're raising a cat, you can't just, you're a team. You can't, you really want, and that's why this education is such a large part of what I do as a veterinary behaviourist, is helping people to understand how to listen to their animal, how to understand how to best meet their needs. And generally that it changes the way you're living with your pet.
And with your education, how did you start that process?
Well, it was really, my zoology background was enormously beneficial going through into my vet degree, but then it was I did 2 years of additional study through the Australian New Zealand College of Veterinary Scientists and testing through examination to be able to say I am now an animal behaviourist. And that was a real eye-opener. But I have also learnt so much more than in any of those degrees from my patients over the years.
And was there, when you first started, was there like anyone that you looked up to, like in your profession?
In WA, there was only 3
Yep.
others, and only one of those was currently practicing as a veterinary behaviourist. And so it was tricky. It was pretty isolating. There's a lot more veterinary behaviourists over on the East Coast,
Yep.
but they were really supportive. And the numbers here in WA now have grown exponentially, which is absolutely wonderful, because I'm not sure that it should be a separate degree. I think behaviour medicine in the vet degree. Probably, maybe there are some GPs that feel that about their profession. There should be more mental health integrated into the veterinary degree.
And with that, just going on with that, I suppose you take it's very much a holistic approach that you take.
Absolutely. And nutrition is a very large part of that, because food is, coming back to that old saying, you are what you eat. And the more we understand with all this research that's coming out on the gut microbiome and the gut-brain axis, and how incredibly important what fuel you put in your pet's body is going to impact how well their brain is going to function. And I've made no secret of the fact that I am not a fan of processed foods for pets, because I think that if you want to have a healthy gut microbiome, you've got to feed that microbiome unprocessed food.
What about food scraps?
I think food scraps are great.
Yep.
I have no problem with those as long as you're careful and you're not feeding one food in high volume. I think in most cases it's very safe, unless you have a pet that has gut inflammation, in which case that might backfire a little bit, but all things in moderation is generally safe.
Now, just going back to when you see your dogs and cats, have you ever come across a situation where you thought that perhaps this animal has been mistreated by the owner?
One of the most common causes of that is if they have used an electric zapper collar, or if they have used, there's a particular training technique in Western Australia that involves the use of a bag of metal chain, and the advice of the people that use that particular device is that you throw it at your pet when they are displaying the behaviours that you don't like. And so people have inadvertently used those techniques with good advice, and keeping in mind that a lot of times these clients have been referred to see this type of technique from their primary care vet, who again is just hasn't had the right education to understand that it's not appropriate to do those things. So there can be inadvertent abuse, but generally I'm extraordinarily lucky, because people that value mental health in their pet tend to be really wonderful clients.
And just going back on that bag throwing, that sounds absolutely horrible.
It does.
Yeah, and so I'm wondering, why is that still legal? Yeah.
I'm wondering why it's still legal too. I also wonder why it's still legal to put an electric zapper collar on your dog.
I was thinking that myself.
And it is really inexplicable. I think people it's changing. It's changing very slowly. The guidelines for pet ownership are changing very, very slowly. I've made no secret of being an advocate for positive techniques. It's been a long time since we have learnt that smacking your child is not an appropriate tool for educating them, and we're still kind of coming out of that. But it is changing, especially as people get more educated and understand why these techniques are not useful. The hard part of these techniques is sometimes they work, but most of the time they work for a very short period of time, because if your pet is frightened enough, then it doesn't matter what punishment you'll use. Their fear will outmotivate. The fear of whatever the scary thing is will outmotivate the fear of the pain.
And I've got this, perhaps it's a theory anyway. If you start throwing, those sort of bags, you're starting to have him, after a while, that dog is, I'm going to use dog, is probably going to snap and become aggressive.
Yeah.
I should probably slowly, making that dog aggressive.
Well, you're doing lots of things.
Yeah,
First
I
of
mean, that's
all,
just one.
but that's a really good point because you're breaking the human-animal bond. You are breaking your dog's confidence in you, and they are feeling less and less safe. But most importantly, if your dog is performing a behaviour because they're frightened, and on top of that fear, you punish them, then you're just going to make anxiety greater and greater and greater to the point that they may use aggression to try and feel safer. Keeping in mind that aggression is not a word that I like to use because it's not particularly useful, but aggressive behaviours are a group of signals that animals use to indicate to you or to someone, to a dog or to something else, that I do not feel safe. I do not feel safe. I need to control this situation. I need space. I need you to stop. And if we don't listen to those signals, that's when we're going to get bitten.
And now, with the education that we were talking about, what are some things that, in your belief, that we really need to be a bit behind on? I know we talked about that, but is there any others?
Let's see. Well, here's one that some people might have spent some time thinking about, which is what is the equivalent intelligence of a dog compared to a person? And we've done hundreds of studies on cognition in animals and dogs in particular. And so far we have not been able to demonstrate that their intelligence their cognitive ability roughly matches that of a 3-year-old child. And that's why I came up with this term years ago, dogglers. I came up with it in combination with one of my co-workers, Tracy Lord. So they're dogglers because they're a dog crossed with a toddler. And it's helpful to think of them in that view because they see the world very, very differently to us. They also, aside from their cognitive ability and the way they see the world, they also their predominant sense is their sense of smell. So they can smell one drop of protein in a volume of water the size of 2 Olympic swimming pools. Incredible. And often anxious dogs aren't doing enough smelling. They're doing too much looking and listening. And the other leading into facts about dogs is that dogs are on some scales clinically blind. We at best have vision that is called 20/20, which means at 20 paces you can see what the average person can see at 20 paces away. Dogs have at best 80/20 vision, which means what they need to be 20 paces from, we can be 80 paces from and see clearly. So they don't have particularly good vision. They really are very much scent animals. And learning about cognition and how they use their senses, I think, really helps us to see them in a different way and understand that they aren't human, they're dog, and they need to be able to engage in doggy type behaviours, and they really don't do anything with intention of causing harm. Harm is often accidental, or if they're really, really frightened, then they may be trying to give a very strong message. But yes, I think there's some of the common misconceptions.
And now, quite interesting with the vision, the 80/20.
Yes.
Why is that? What? I'm just going into anatomy here.
Yes, we are. We're going into anatomy and we're going into evolution, and really the dogs are a body that is optimised for scavenging, and to be an effective scavenger or a predator, they obviously do predate as well, and to be effective at those things, the sense that's going to matter the most is, of course, your sense of smell, because prey species are going to be very well hidden, and scavenged items are also going to be well hidden. So it's no use listening and looking if you're going to be an effective predator or scavenger. You want to use your nose. So that's why they're very good at using their noses. Some better than others.
Yep. And now, we've talked about barking, we've talked about, peeing in shoes and in the garden, digging up holes. Why are they the most common problems?
I think that the barking is the most common problem because it is generally the behaviour that a dog does that is most alarming, because it gets our attention. And so it really irritates people and it really frustrates people, and we just want a bit of quiet because people too tend to be quite noise sensitive. The digging holes is tends to be a problem because we are sometimes not able to meet the needs of our pets, or they might be digging to escape.
Yep.
Or they might be digging because they can hear things under the ground, or they might be digging because they can smell things under the ground. And so it's a lack of meeting your dog's needs and remembering that this is a dog, and dogs, it's normal for dogs to dig. So it's addressing the normal needs of our pets. Cats, urine marking, it drives people bonkers, and I can fully appreciate that. But it is, we used to use this term that it's inappropriate urination.
Yeah.
Well, we think it's inappropriate because we're humans and we think that you should wee in the toilet, but it's totally appropriate for cats because they use it as part of a complex signalling mechanism, and they're trying to send a message, particularly cats that aren't very confident and they don't want to, be confrontational. So they'll just send a little wee mail and let people know that, please don't come here because this is my house and this is my favourite sofa and I'd prefer that you didn't come here.
I used to have a cat every now and then would deliver me a gift every now and then. It would be, it would go outside and it would usually be a rat.
Was it alive or dead?
Sometimes both.
Yeah.
And my cat would come jump on my bed with this still in its mouth going, here you go, I've got you a present.
Isn't that lovely?
It's
so thoughtful.
Oh, yeah, I really want it. Thank you so much.
It's just what I wanted first thing in the morning.
First thing in the morning.
Is a mostly dead rat.
Breakfast.
Yeah.
Yeah, so, why do cats do that?
Cats do that because when they live in a community and they very much, it's about contributing to the betterment of the family, and also most cats are very satiated, they're full. Yep. And I've caught this rat because I'm a predator, but I don't nearly need it all and I'd like to share it with you.
Oh, thanks so much. I'll cook it up for dinner. Yes. All right. Now, what you said earlier, you treated some birds as well.
Yes.
How is that different from cats and dogs?
It's very, very different because birds are very few generations removed from the wild population. So cats and dogs are very much domesticated over thousands of years. We've been living in partnership, whereas birds are a relatively recent relationship. And so a lot of their behaviour problems come from just not meeting their needs. So with birds, there's a lot of environmental management to try and give them outlets for normal bird behaviour, because one of the most common problems that we see in birds is feather plucking, and they will pluck all their feathers out until they're nakedy nude and they look absolutely dreadful, and mentally they do suffer greatly as well. So it comes from a lack of understanding often. Birds, I think, are very challenging to care for because they do have a high level of need, especially if you're getting a bird that is going to need a partner. And a lot of these parrots as well, they bond for life and they live for a really long time. So some parrot species are going to live in captivity with you for 80 years. And that's a huge commitment when you're looking at caring for an animal for that length of time.
And I guess with birds, I was thinking maybe the cage environment would be
absolutely
huge.
So we need to give them outlets to engage in normal foraging, and they need to have a nighttime nest or a nighttime cage, and then they need a daytime space that does involve flying and exploring and foraging that's appropriate for the species. And they do need a lot of mental enrichment, otherwise they do slowly get institutionalised and they really suffer.
And birds are quite interesting because, like you said, that, cats and dogs are domesticated. So we're really taking them out of their natural habitat, and we're asking them, hey, look, this is your habitat now. Go and
exactly.
Yeah. So
it's really hard for them, and it's very hard. You've got to be very committed to have a bird as a pet, because they do require a lot of support to live a happy and healthy life.
And speaking of support, and I know I'm going to talk about support networks, but do cats and dogs need different support networks, or are they similar?
They're relatively similar in that, we always talk about it takes a village to raise a child, and it definitely takes a village to raise a dog and a cat. The more support anyone has, generally the better. But yeah, for cats and dogs, you really need one good human in your life. That's enough.
Yep, I agree actually. Yeah. And now I want to just roll back into Kalmpets. As you've been doing that for quite a number of years now. What has been some of your challenges?
In my job, the greatest challenge, which is going to be ongoing, I suspect, for the duration of my career, is a lack of understanding in the broader community about mental health and being afraid of the discussion of mental health, not just in animals, but also in people. And I'm constantly advocating for mental health. I know the brain is a complex organ, but it's just an organ, just like your kidneys and your heart and your pancreas, and all of these organs can sometimes not function in an optimal way. And we really want to open up discussions about advocating for mental health, and I think in people as well as pets.
And I guess with that mental health, do you find, 5-10 years ago, for humans there was that stigma, and do you find we're still in that stage for the pets?
Absolutely, especially when it comes to medication. It is something that is greatly feared, it's greatly misunderstood, and I think perhaps some of that comes from misuse, inadvertent misuse. But the more that we learn, or constantly learning, and not being afraid to try something new, I think as well. But I think we still have a really long way to go with our general broader community understanding of mental health.
Actually, you bring up something quite interesting. Because in the humans, we medicate. Why is that different to, why is it that fear around doing it to the animals if we're so happily,
This is a good question. A lot of the fear comes from people's own experiences with medication, and they don't want that for their pet.
Yep.
Or they just don't think that they don't understand mental health at all, that it is something that medication can help with, and they're generally afraid that their pet's going to be turned into a zombie or sedated or just a dribbling blob in the corner. And I think probably there's a whole complex answer to that, involving movies from the 80s and of mental health institutes, and there is just a general still a general stigma there. I think we're getting better, but I think the conversation needs to most definitely continue in mental health, because it has the greatest capacity to improve the well-being, not just of pets, but of people. And I've found in my own experience, I've been really fortunate with some of my clients who have said, thank you so much for explaining that to me. I'm going to apply that to my own mental health, and that has made a really big difference for them. But also I'm really lucky that my clients have been open to sharing their own mental health struggles with me, and I think that really helps. They make the best clients because they understand what it feels like for their pet.
It's like a lived decision as well.
Exactly.
Like, I've had this myself. I don't want my pet to, suffer.
Exactly, yeah. But there still is a lot of, coming back to the medication thing, people are afraid. And I always say that I want what you want. I don't want a zombie. I don't want a sedated, drooling blob in the corner. I want a happier, healthier, more robust, more able to learn pet than we've currently got.
Now, in the industry, you've obviously seen a lot of change. What are some of the really good changes?
The really good changes are that the understanding of not using punishment, that is changing a lot. That has changed dramatically. There is a little bit of pushback, and there is sort of all different terminology that's being thrown around, keeping in mind that in Western Australia you don't need to have a qualification to call yourself a dog trainer. Not that I am a dog trainer. I'm definitely, my expertise are in mental health, not so much as being a dog trainer. I work collaboratively with dog trainers. But there are lots of different types of training methods. Some are punishment-based. Some call themselves balanced trainers. and some are positive reinforcement. So it is really, there has been a very big shift towards the positive, which is wonderful to see. And that has been one of the biggest changes, I think, in my industry. And I think in general, a greater acceptance of or more people correctly identifying that what their pet is actually experiencing is anxiety.
I'm not going to throw shade at the dog training industry, but I will make a little comment. You were saying that you don't have to be qualified. To me, that kind of sounds like you're going to get some bad apples, but you are also going to get some people who are doing the right thing as well.
Absolutely, what I'm working on with a couple of different councils is an education program so that people can critically analyse trainers, looking at their websites and how to find a trainer that is going to best support the needs of your pet.
And I guess just with that, you can also look at not only the best needs of your pet, but you might be able to, I'm just kind of thinking out loud here, you might be able to start regulating some of these as well.
Yes, and I think one of the big things when you're getting advice from anyone actually is your intuition. If you're sitting there listening to someone going, I'm not going to do this. I'm not going to throw a bag of chains on my dogs. That feels wrong. I'm not going to smack my dog. I'm not going to isolate my dog. If it feels wrong, then they're not for you. Wrong person, find someone else.
And we do that with doctors,
Absolutely.
generally, or whoever. If we think, okay, this person's a bit of a quack, we can't stay away from.
Yeah, we gave it a go. I won't be going back.
Yeah, exactly. Next one. Yeah. When you started, what was some of the things that you did that you don't do now?
Let's see.
And why?
Okay. One of the things that I used to do and I don't do now is write a big long report after the consult, because I found that no one ever read it because it was just information overload and it was very, very time consuming, and I put a lot of effort in for
not much.
No gain for anybody. And so I don't write big long reports anymore. They used to be about 20 pages long, so I don't do that anymore.
Yep.
I don't do really long consults anymore for the reasons we discussed. And I don't do a lot of house calls anymore. So I used to be only house call based, but now I am clinic based. And the reason for that is because one of the things is my safety, which is not often an issue, but sometimes, there has been one or two occasions where it was an issue. It also enables me to have absolute control over the environment that I'm going to see a patient in, and that puts a little bit of stress on them so that I can see how does this patient deal with novelty. It means that we can do a much more thorough assessment of them without the distractions of home. So I've completely changed. And the one comment people often say is, but how are they going to know what the behaviour problem is they don't come and see it? And I always say to people, I know what a barking dog looks like.
Yep.
I know what an aggressive dog looks like. I don't want to see the behaviour in the flesh.
Yep.
That's not helpful for me. It's a bit like if you were taking your child to a psychiatrist because they had impulse control issues. You don't need to see a child lose it to understand the problem. Yeah.
Okay. Now, what is one of the most misconceptions of your role?
I think that there is a lot of confusion about the difference between an animal behaviourist or a veterinary behaviourist and a trainer. And that's where I think what is a useful analogy, which is that I'm more like a human psychiatrist and the trainers I collaborate with are more like the OT or clinical psychologists. So they are they do incredible work.
Yeah.
They are on the ground. They're the ones who are doing the conditioning, which is replacing the feeling and behaviours that dogs have about certain things with more desirable alternatives. Whereas I'm trying to cross the first hurdle, which is get this patient's brain in a state where it can learn in the presence of scary things. That's my role, which I think is just one tiny piece of the puzzle. So I am not a trainer. I do know how to do training, but I do not have the skills that the incredible trainers that I work with have.
Well, Dr. Kate Lindsey, it's been an absolute pleasure. Thank you so much for joining us.
Thank you very much for having me.
All right, thanks.